Hey guys, my name is Nia. I'm a recent occupational therapy assistant graduate and I am currently studying for my NBCOT exam, and the big date is July 2nd. I'm really excited, but I'm very nervous at the same time. So I've been researching online and looking through books and stuff like that, and um, I haven't really found certain sources to go to, and I've also found some really good sources to go to and some really cool tips and tricks. But I kind of want to save you guys some time from looking around and to give you a few tricks that I learned that are kind of easy to remember. And I wrote them down for you guys, and I'm going to read it to you in a second. But basically, if you remember these tricks, you probably would have a better chance of passing, and maybe it'll help you further study something you're having trouble with. So let me read them to you. Number one, anytime you remove somebody from a group session, and the only time you remove them from a group session would be as if they're physically threatening someone. So say if they're distracted or not paying attention, that's not really necessary for you to discharge them or kick them out of the group or whatever. It's when they're actually physically threatening someone. Number two, must take care of pain and range of motion before working on strengthening. So usually pain trumps all. So when there's a question that talks about pain, and then the options are manage pain, work on strengthening, work on uh, range of motion, you would want to pick one of the responses that says work on pain first, and then range of motion, then eventually work on strengthening. And also remember, don't work on strengthening for anybody who has a progressive disease like multiple sclerosis or ALS. Number three, if the question sounds like a violation, the most serious choice is usually the answer. So, for example, say if an employee was stealing, you don't want to say, oh, document it or wait till the next meeting to discuss it. No, the most serious answer would be like reporting it to the supervisor. So anytime that something happens like that, you want to pick more of the serious answer when it sounds like a violation. Number four, do not choose family for an answer if they do not have cognitive dysfunction. Only choose if it is a question about the same, uh, some type of dementia or pediatrics. So basically, do not choose family for the answer if they're cognitively there. So say, for example, somebody who left cardiac rehab who's fully cognitively there, but he's being discharged to go home, and he is leaving, but if the choice says, oh, can't leave until family or caregiver can pick him up or whatever, that's most likely not the answer. But if he or she is being discharged from like a psychiatric unit, they have dementia, or it's a kid who's under the age of 18 and usually can't think for themselves, it will be the parent or family involved. Otherwise, family might not be the answer. Number five. Okay, number five is Medicare does not pay for raised toilet seats, but it does pay for a 3-in-1 commode. So, Medicare does not pay for a raised toilet seat, but it pays for a 3-in-1 commode. So you know what a commode is. It kind of looks like a walker with a toilet seat, and it has a 3-in-1 function, whereas a raised toilet seat only has one. So usually Medicare only pays for things that are multifunctional, and they will last throughout the progression of their disease or disability. So if basically they're not getting their money's worth, then they're not going to reimburse it. So like, for example, like electric wheelchairs or like communication devices sometimes are harder to get reimbursed by your health insurance because they are more expensive and not necessarily is necessary to them. Number six, Anyone with a progressive disease do not build physical skills. Oh yeah, I already mentioned this one. Number 7. Where's number 7? Number 7. If the person talks about sensory processing, sorry, why I say person? If the question talks about sensory processing, the answer should not be working on strength. So if it's a sensory deficit, why would you work on strength? You would work on things for sensory input or stimulation or something that they're lacking instead of working on their strength, because strengthening is not necessary at that moment in time because their problem deals with their senses. Next one. Yoga and stretching put the least amount of pressure on pulmonary and cardiovascular systems. So if a person is coming from cardiovascular rehab, and initially you would want to start with something more light, like yoga and stretching, and then eventually do light walking, and then progressively do more intense cardio, maybe strength training. But the key is whenever you are in cardiac rehab, do not do isometric exercises. That is actually a contraindication. So remember to start lightly and work on your breathing and things like that. The next one would be offering suggestions is not a component of client-centered approach. So if a client is saying, hey, I really want to work on, getting dressed and stuff like that, when knowing that it's probably not a realistic goal for them, they really want to get dressed. So they want to learn how to be more independent with it. So you don't want to say, you know what, let's work on feeding yourself first. Or let's work on bathing first. That's not an example of client-centered approach, because when you're making suggestions, it's not going towards how they feel and giving them what they want. So if they cannot, they're not able to get dressed yet or do whatever, you want to try to adapt the task as much as possible and do what they want to do as um, as realistic as possible without forcing them to do something else. And that's what's considered client-centered approach. You always do what the client says, pretty much, within reasonable boundaries most of the time. But you know how to use your ethical judgment on that one. And let's see. I guess that's so. If you have any questions or comments, please leave a comment below or ask me to make a video on something else that you're having trouble with, or maybe some study tips you'd like to share with me. Thanks. Bye.